Welcome to Mom in Mind. I am your host, Dr. Kat. On our episode today, we are welcoming Keisha Reeves, who is the owner and clinical director of Push Through Therapy. She's a Georgia native that has witnessed the stigma of mental health and has made it her mission to normalize therapy. She has been in the mental health field for more than 16 years. And more than that, now she is a certified perinatal mental health provider serving birthing parents who are trying to conceive, have fertility issues, have experienced infant loss, transitioning into parenthood, as well as perinatal mood and anxiety disorders. She's volunteered with Northside Hospital's Infant Loss Bereavement Group. She served 3 years on the Postpartum Support International Georgia chapter board as the training coordinator and currently volunteers as an educator to providers treating birthing parents in their practices. She's a facilitator for the Mocha Moms group at the Atlanta Birth Center, and she facilitates her own Black Moms group through Push Through Therapy. We are hearing from Keisha today some of her personal story and also some of the factors that make Black maternal mental health and reproductive education so important. And she shares why and how it's a strong passion of hers, as she was the founding coordinator and presenter for Black Maternal Mental Health Summit for PSI Georgia, is one of the ways that she's spreading the education and knowledge and trying to get support to the people who really, really need it. Providing access to resources and providing mental health services to women of color is a mission of Keisha's. This conversation is incredibly important, as are all conversations that have to do with perinatal mental health for women of color and specifically Black women in the United States. Keisha shares some of the reasons why it is so incredibly important we're having this conversation and continuing the conversation. This is an important drop in the bucket, our chat today, and really vital that this conversation is shared with as many people as possible. So, without further ado, here is Keisha Reeves. Welcome, Keisha. Thank you for being on with us.
Thank you so much for having me. I am so excited to have this conversation with you today.
I'm really excited too. We just kind of met in person as we were talking about before we started last year, and just reading through your bio, just how many amazing things you've done and you're doing. So some of that, we're going to share with everybody today. But in terms of how you even got started on this journey, I'd love to start there with you, wherever you'd like, about how this journey started for you.
Yeah. So I started in private practice, oh gosh, around 2013, 2014. And I was then just like a solo practitioner. And at the time, I was just specializing in general women's issues.
Hmm.
And I noticed that I was getting clients that were experiencing perinatal mood and anxiety disorders, but they didn't have the language to it, nor did I have not much in-depth education on it.
Hmm.
As we know, there for my grad program, there was no PMATS course
Right.
or anything in depth with that. So I had decided to get additional training through PSI. But it was right before I flew out to Arizona to have my 2-day training back in 2017, that I had had my son January of that
Hmm.
year.
Mm.
And it's so interesting sometimes when I'll talk to people and I'll say, sometimes one would think that a clinician would be able to pick up on signs and symptoms
Right.
themselves.
Right.
But I didn't. Like I was in the depths of postpartum depression and anxiety.
Yeah.
And with Ezra, my first, it was an easy pregnancy. I've always been an active runner most of my life. I ran up until I was like 8 months pregnant
Oh,
until
wow.
my pelvis just said no.
Not today. Right. Right.
Not today. And labor and delivery was pretty simple. But like when I think back, I could almost see like the signs like showed up immediately. Like I remember thinking about how on television it was portrayed as if like a woman would have her child and immediately there was this instant connection,
Right.
and I didn't feel that with
Mm.
him.
Mm.
And I remembered, even in the hospital, just wanting like a break to just be by myself.
Right.
um and once I got home, our environmental factors or risk factors were really stacked up against us. My
Mm.
husband had just started a new job that was 2 hours away where he worked
Whoa.
hour shifts.
Oh my gosh.
And we had no family available in the area that we lived. Our friends also lived far away from us. And Ezra was colic,
Mm.
and I was a first time mom by myself at the house alone. And I
Yeah.
was trying to adjust to breastfeeding and, trying to make him feel better because he cried all the time.
Mm. Mhm.
And I remember there was a point where it was like 3 days and I hadn't slept at all.
Whoa.
One morning when my husband was trying to have a conversation with me, and I saw a woman standing next to him. And I was hallucinating because I was
Oh.
so deeply sleep deprived.
Oh my gosh.
And it was just like a struggle because it was like this cyclical effect of being anxious every night, of wondering if this is the night, am I going to get to sleep?
Oh.
Or if I did fall asleep, and if I tried to go to sleep, am I gonna be able to actually sleep long enough?
Mm.
And then feeling just sad because, you feel as if this life now? Like, is this my
Right.
life now forever
Right.
and hopeless? And
Can I ask a question about were you tired? Like exhausted, tired and couldn't sleep? And like
exhausted,
and
tired.
everything, yeah, you just would not fall asleep even
Mm-mm.
though you desperately wanted to.
Right. And then
Mm.
sometimes it would be like he would fall asleep and I would fall asleep, but it would, how like sometimes broken sleep can make you even more
Totally.
exhausted.
Oh yeah.
Like you jolt awake because
Mhm.
they're awake, but you just hit REM sleep.
Right, right.
So it was definitely that. And then just this feeling of wanting to like get it together, like in my mind, like
Yeah.
definitely suffering from strong black woman syndrome,
Mm.
not wanting to ask for help, not wanting to appear ungrateful
Right.
or weak.
Mm.
And so it was that way for like 2 to 3 months.
Oh my gosh.
Yeah.
Were you just quickly going back to that moment where you had that hallucination? In that moment, did you realize that that's like what was happening? Were you
No,
What was that like for you? Was it like scary? Was it confusing?
it was confusing.
Mhm.
Um, and I remember describing it to my husband like later, maybe like a couple of days later. And I was saying, I don't know what that was about. And I was also like in the midst of brain fog.
Oh yeah.
So I think I kind of like associated it with that at that
Mhm.
time.
Mhm.
Not
Mhm.
like thinking like, no, you're sleep deprived, you're hallucinating.
Mhm.
But just like, oh, well, my brain is just not functioning. I couldn't remember anything. I
Right.
couldn't think clearly. I couldn't critically think, reason. I
Right.
was not in the position to safely be responsible for another human being at all.
Right.
And um, it wasn't until the point where I think I recognized that I wasn't okay
Mm.
that I sought out therapy. And from there, working with my therapist of trying to create all of the avenues to be able to support myself. Because there was also this guilt of, well, my husband is working 12 hours and he's 12 hours away. I don't want to bother him. And I'm at home. I was staying at home for several months. And, this is my job. I should be able to do this.
Right. So much
Like,
pressure.
right, falling into all of that. And I had to recognize what I needed to do for myself so that I could show up as the best version of myself.
Right.
And I say all of that to say that it was really like a lot of aha moments when I went to that PSI training in Arizona,
Mm.
where I was really like introduced to intrusive thoughts and like how sleep deprivation can trigger so many different types of disorders within the spectrum of PMADs.
Yeah. Yep.
And, not only like as a clinician was it educational, but it was also kind of like a sense of peace for myself that it wasn't like just me.
Mhm. Right. Yeah, that
Aha
is so
moment.
real. So,
Yeah.
so
Like
good.
there's nothing wrong with me.
Absolutely. Uh, and yeah, so um, when you're in that 2-day training, um, it's like it can feel like one thing after another, like, oh, that's that. Oh, okay. Because it's really jam-packed, there's a lot of stuff that you're learning. And to your point earlier, we don't get taught this in school.
Right.
It's just it's a shame that we're not. Um, but I wonder if, as a therapist and working in the mental health space, if that added another layer for you of, I don't know, like the stigma or the shame that, and I'm speaking from my own experience, that's what I felt. Like, did it feel that way for you too?
Yes, absolutely. Because you just often, I mean, it was so many different layers of shame for it because there was one of, I mean, like, even when I would try to talk to family or friends, I was met with, well, isn't this supposed to be the most joyous time of your life?
Huh?
Or well, you're a clinician, you
Yeah.
you would know. Or even, your ancestors were able to do it, so you should.
Ooh, that is like hundreds, thousands of years of pressure.
Right, right.
Just right there.
Absolutely. Yeah. So anyone would just kind of like go inward and not share like the
Sure.
difficulties in it.
Right. So for those, what was the amount of time, again, from the time your son was born to the time you went to that training?
3 months.
Oh, okay. So
Mhm.
in between there, you kind of knew something wasn't, you weren't feeling like yourself.
Right, right. It
Okay.
was, well, no, not exactly. So I had him in January. It was about March when I recognized that something was off. I attended the training in May. So I
Ah,
was already in the process of in therapy,
oh,
getting
got it.
things like aligned for myself. And then things really came full circle once
Hmm.
I attended the
Okay. Wow. So, um, it's just so interesting that were you already on a path of supporting birthing folks before you attended the training?
not to the extent of what I was afterwards.
Uh-huh.
Um, because before it wasn't my target audience, so to speak.
Right,
Like
right.
they kind of fell into the pot of women's issues.
Hmm.
But it wasn't until after I attended the training, had my own experience, where it like then became my mission.
Yeah, right. For sure. And
Mhm.
then with you kind of being in your own healing journey, how was that for you to like be learning about it and, you know, trying to get back to yourself, so to speak?
It was, like often like in therapy, we talk about like transference and countertransference
Hmm.
and things that can show up. I will say that even working with clients and their own resilience was inspiring for me and empowering.
Mm.
And then also just being able to see them, and them being able to see me see them and to relate, and to hear them and to validate them. I
Yeah,
think
yeah.
like also worked because it's one thing if you work with a client and it's some issue that you have like absolutely no experience in at all, but you're just helping them from your own educational toolbox. But
Uh,
it is pretty resounding when it's something like you've been through and you have your own like personal testimony, rather they don't know like the depths of it at all,
mm,
but you could be able to really help them because you've been through it and that empathy could just look a little bit different. And so I was just very intentional about putting things in place for myself and my own self-care.
yeah.
But I also just felt so mission driven to
Hmm.
not have people because I knew like if I was a therapist and this is what it was like for me, I couldn't imagine what it would be like for someone who had no psychology background at
Hmm.
or
Hmm.
no access to care because I'm in Georgia in a rural area where they may not have a culturally competent clinician or someone who has any educational background in this at all. I really wanted to support those so that they wouldn't suffer, their child wouldn't suffer, their
Right.
family would suffer, and they wouldn't feel like something was wrong with them.
Yeah, I would love to follow up with what you were just saying, like, being in a rural community, not having a culturally competent therapist or um, it- I'm assuming also few resources, few like people who have training in perinatal mental health. But in
Right.
rural communities, that's typically true. Was that true, or is that true where you are?
Yeah, so I am in Atlanta, which is fortunately a great resource birth driven community. I mean, I'm in the state of Georgia, so obviously there's tons of work that needs to be done. But as far as like access to care, for doulas and midwives or OBs or we have our PSI board, here. But once you step outside of Atlanta,
Uh-huh.
and there is the more rural areas. There isn't a lot of culturally competent clinicians, or there isn't a lot of people who are specifically trained in PMADs. And it's unfortunate, because a lot of people will not choose to get help,
Mm,
in fear of the shame or stigma or not being heard or listened to, or, having a bad experience with someone previously.
mm,
And also the fear of getting misdiagnosed,
right.
perhaps being thought of as having a diagnosis that they don't have, or if their children will get taken from them because they're trying to share the struggles that they're experiencing.
Right.
And I think that, there's a lot of work to help remedy that and help change that. But it is something that's still like an ongoing issue.
Yeah. How, in what ways, I guess, in your practice now are you seeing um, this, gap in adequate support, um, trained support, culturally aware support, I guess. I guess my question is, what kind of effects do you see on Black women or the Black mothers or Black folks that you're supporting?
I think, well, to go back a little bit, so recently I did a training um, on like understanding perinatal mood and anxiety disorders. And I'm always eager to see like what are the different types of disciplines and demographics that will attend the training.
Mm,
And typically, the people who attend are, folks who have a genuine interest in specializing in PMADs. But I, in my own personal opinion, think that everyone who sees anyone in the therapy space should have a general basic,
hmm.
course on
Absolutely.
PMADs.
Absolutely. I second, third, and fourth that. Yeah.
Right. If you see a parent of any sort of however they identify, you should have this training. And so I think that the gap starts there.
Mm, hmm.
Just not like for there to be, providers that may feel as if like, oh, well, this doesn't have anything to do with me, or I don't have to have this education. Or if they feel as if the area in which they serve or the clients that they see don't identify as people of color, to have no interest to learn about Black maternal mental health
Hmm.
and the statistics. And I think that that kind of ongoingly perpetuates the statistic. Like if it's 1 in 3 of Black moms that experience PMADs, and it's aside from the risk factors that we have, like the ones I shared of lack of support, or whether it's financial issues or geographical region, but if it's discrimination, and if it's racism, and if it's lack of trust in the medical system, and you are someone as a provider who doesn't want to learn about any of those things, then you will really miss, being able to provide adequate care for someone, or for someone to feel as if they can trust or feel safe in space.
Oh, sure.
And so the clients that I do see whenever it shows up in practice, it's typically like they've gone through a birth trauma, or they've experienced, any type of postpartum anxiety, and have literally sat with this for a year or two.
Right.
And it wasn't until like they've stumbled upon my practice where they may have come for a whole separate issue. And they
Right.
just, like, oh, you have a 2-year-old. Oh, by the
Mm,
way, what was, postpartum like for you?
mm,
Oh, well, this, and this, and this. Oh, why didn't you ever seek help? Like that's a lot.
uh-huh.
Well, this is why I didn't seek help. And, when someone has to carry that on top of whatever life brings them, it just really, you know, makes that plate even heavier of
Oh yeah.
stress and mental health.
Yeah. Um,
That was a
mm,
mouthful.
no, no, it's a great mouthful. And it's so, I mean, you're talking about people's real lived experience. It's not theoretical. This is, people are telling you, Black women are telling you, um, that they don't have either access to or knowledge, I guess. Like we're still trying to figure out how to make sure everybody knows that this is even a thing.
Mhm.
So, in terms of that information, but to be able to, like you were saying, even realize that something was going on and pushing through that.
Mhm.
Um, I don't know. How, maybe you can speak to this, the idea of what type of mom you're supposed to be, and while we know that there's just generally a societal pressure to uh, you're supposed to love this and all that. Are you? What do you think is like specific maybe to the South? If there's like a cultural component in the
Mhm.
South of like pressure for moms.
I would say specifically for Black mothers in the South, it's culturally, and this is something that's just for the past that has built it up. Not that it exists or that it's right, but that you're able to accomplish the tasks that are needed to be done. And nothing necessarily needs to interfere with that. So sadness or anxiety or crying spells needs to interfere with being able to go to work, maintain your household, take care of your children's needs, all of the responsibilities on your plate. You're supposed to be able to adequately accomplish them. There's no space to, we don't have time to cry. You have to get things done because if you don't do it, who else will? That's kind of like
Mhm.
the I don't know, the mantra or what was kind of exhibited to follow. And
Uh-huh.
I think that it's been work to kind of dispel that
Mhm.
and make it known that you're not inadequate because you need to go to therapy or because you need to cry or because you are anxious or you're overwhelmed or you need help. It doesn't mean as if your family can't function or can't excel because of that. It doesn't mean that you're failing in any type of way. If anything, it means that you are able, and a big thing that I'll tell my clients, you're able to show up to be the mother that you want to be.
Mm.
Because when we are filled with not giving ourselves the space or the privilege to take a break or sit down or take care of yourself, that you can be irritable and you can snap and you
Mhm.
can, not spend time or be present with your children in the way that you want to, not discipline in the way that you want to. And especially if you want to get rid of generational habits,
Uh-huh.
um, taking care of yourself helps you to be able to do that.
So yeah, you used a word, generational, I think is really important, and if I to highlight that there, if you can speak to like why there is a reason, what has shaped this like generational mantra, as you said, that just sort of put your head down and do all the things you're supposed to do, and not have any feelings about it.
Right. I think it goes all the way back to 1619, whenever Black people in America, Black Americans were enslaved. There wasn't maternity leave, there wasn't short-term disability. There was have your child and go back in the fields and pick cotton or take care of the owner's children and support their family. And I think generationally that's passed down when you are an oppressed people
Mhm.
who are discriminated against and don't have the same privileges or opportunities. You
Mhm.
have to do what you have to do to support your family.
Mhm.
And so there wasn't the luxury of therapy or days off or, being able to just sit down. I think that over time that just continued to pass down from grandparents to mothers until their children. And it's definitely something that's hard to break, specifically in the South.
Mhm.
Um, but I think with the awareness of mental health, and this being Mental Health Month,
Mhm.
I think that a lot of work has been done to help with that. But it's definitely ingrained and it's existent for centuries.
Yeah, for sure. I always had this image just flash in my mind. I watch Finding Your Roots
Mhm,
with Dr. Henry Louis Gates. I love that series.
mhm,
Um, but I just, it was yesterday actually. In one of the episodes, they were showing a picture of enslaved people working on the plantation, mothers, um, parents, and two little babies sitting in one of the rows, just kind of, hanging out there. They had to be there. That was the only option.
right.
Like mom had to work and babies came with, and that I just in terms of like the generational um the history there, what you're describing in my mind, that was just like that's a snapshot that kind of
Um,
encapsulates in a way, in a very sort of brief way in a picture, um, that the history there, the
yeah,
reasons why.
yeah. There's this
Um,
quote that I love by Toni Morrison. She's like my favorite author. But she was speaking to how motherhood for her gave her this sense of freedom.
mm,
And which is, interesting because we talk about, like matrescence and how like
mhm,
some women feel as if it brings a lack of freedom. But she was talking about it in relation to her ancestors
uh-huh,
and saying how when enslaved women gave birth to children, that it wasn't theirs, that their children, could be taken from them
right,
and was property and was
hmm,
owned by the people that owned them,
right,
and how generationally, things have changed from that. But I couldn't imagine, what that experience was like and
hmm,
how, we were talking about you just did what you had to do and how that mantra has existed from then. It was like that was a coping mechanism of just being able to just get through day to day to
right.
just function.
Yeah. And in some ways, like, um, protective.
Mhm.
If you didn't do what you had to do, there was punishment
Right.
immediately for you and potentially your child. I mean, there's like an um as you were just saying how hard it has been to break, because I
Yeah.
mean, it wasn't that long ago. It
Right.
really wasn't that long ago,
Mm.
that that slavery was abolished, but then, historically there were so many other things that came in that were like enslavement, but just were just under some different law that got twisted and whatnot.
Yeah.
And uh, it just, the kind of like quote unquote reasons it's taking so long and it takes so much work to to break through the stigma, or that sense of like, I don't know if you'd call it like responsibility. There's probably a better word about
Mhm.
like I have to do this in order to protect myself and my children.
Right.
Um, it's really quite deeply ingrained.
Mhm. A lot of the times, like within my practice, I know as far as like statistically with postpartum depression and postpartum anxiety, but antepartum anxiety is also very huge.
Uh-huh.
And specifically for like Black mothers in being anxious about what labor and delivery will look like for them, if they will
Right.
live, if their child will live. And then also the responsibility of being a parent to a Black child once they're
Mm-hmm.
in this country,
Mm-hmm.
and how that impacts like their attachment style, their parenting style. and how anxiety kind of just exists. It's this cloud of figuring out how to function in that way.
Yeah, that is a really good, I mean, there's so much in there that we could deep dive into. Um, um, and also for I think it's important what you're saying because there's there's a way in which the anxiety that someone might be experiencing isn't random. It's not for
Right.
no reason.
Right.
It's there for a reason. And so how do you, I guess, thread that needle of it's reasonable to have anxiety and also, you know, it's impacting you.
Yes, absolutely. Even like sometimes, okay, bringing this point. So I have two kids. That was my experience with my oldest, Ezra. When I had my second, I was definitely proactive, had all things in place, supports, everybody knew their roles of how they were going to show up. There was no shame. I was on it.
Mm,
I had my second April 1st, 2020,
mhm.
um,
Okay.
right after the world shut down.
Oh my gosh, right, right.
And then there was this civil rights uprising,
Mhm,
where there was a killing day after day. And I had my second Black son. And, when you say that, like, anxiety is something that, for Black mothers isn't, something without reason, as proactive as I was, there's this anxiety that shows up,
yeah,
again. And I'm thinking to myself, I did everything right, but these are things that occur um just by just living in society as a Black mother.
right,
And when I try to help with clients, who experience that, being relatable, completely understanding where it comes from, also trying to help them just be present in the
mhm,
joy of motherhood.
mhm, mhm.
Because I get how you can immediately go to, well, I have to equip them for when they're driving their cars, or I have to, go over the script with them when they're walking from the store. But it is a newborn and they're not able to drive or walk, and
Mhm,
you
mhm.
deserve the joy of enjoying your newborn. And let's just sit there for a bit and be in that space.
Yeah, yeah, absolutely. It's, it's twofold. Like, yes, there's a lot more information being shared, and people are learning about things like maternal mortality and whatnot. But to your point, what you're saying is that, like, that now that that's in, people's minds, I should say, it's like more present in media and social media. It's not like there's a full break
Right.
from remembering that these are uh, occur- I don't want to say dangers. What do I want to say? That it's there, that it's a reality. Um,
Right.
so it's like, I think, and what you're saying is important. Like, two things can be true at the same time.
Absolutely.
Um, but it's hard. I mean, it's the skill that you're trying to help Black mothers um, embody is it's hard to do.
Mhm.
I mean,
That's
it's an active skill.
Mhm. Right. Yeah. But definitely similar to what I was talking about Toni Morrison's quote.
Mhm, mhm.
And like what you said, two things can exist. You just still deserve the joy of the incredible thing that you just went through and you had and brought into this world.
Right. Yeah, that is so deeply important because it is part of breaking the generational trauma,
Mhm. Mhm.
taking that space.
Right.
Um, and I think it's important coming from a Black clinician to a
Mhm.
Black mother. Um, I think it's different, if I say it. In some way to a Black mother. It, I w- what do you think about that? Like, yes, it can be still true, but it's different hearing
Mhm.
from somebody who really understands what the day to day feels like.
Absolutely. I definitely think it can be even more resonating when it's someone that looks like you.
Mhm.
And I think that, going back to culturally competent clinicians, if you're in an area where this is the population, where you have a diverse population of potential clients, but there isn't a diverse background of providers,
Yeah.
I think to be educated in knowing that there's a level of how you may resonate with your clients, but still being able to see them and to understand, have sympathy or have empathy of understanding that this can be very difficult for them
Mhm.
versus being completely oblivious and having no desire to have an understanding at all.
Mhm. So we've been talking about all of some of the ways in which perinatal mental health is important for Black mothers. Um, what would you like to see? How would you like to see this progress in terms of maternal mental health?
I would love it if everyone would jump on board the bandwagon of maternal mental health, not just mental health providers, but for medical practitioners, for community folks, just for everyone, because I feel like that is where the beginning of life begins.
Mhm.
And I think that it is so vital for the person who is carrying new life to be in a great mental space, for the environment in which they live, they
Yeah.
cohabitate, to be supportive of that. And I would think it would be astounding if we could see the impact it would have on the world, the country,
Mhm.
statistics,
Mm.
if everyone was heavily involved. And perhaps I'm coming from a psychodynamic theoretical approach, but I do believe that it impacts so many different areas if we look at the day one of everything,
Mm.
how people do attach, how people form relationships and friendships and parents, how they deal with stress in the future,
Mhm.
um, how they just function in society. And
Mhm.
I think that it shouldn't just be in the hands of birthing parents to figure it out,
Mhm.
or for mental health providers. I think that it is a world issue to take part of. And
Right.
and it's always so interesting to me when I meet people and they'll say, "Oh, you're a mental health therapist. What do you specialize in?" And I'll say maternal mental health. And they'll say, "Oh, I didn't even know that was a thing."
Right.
And I'm thinking like, how could it not be? like, like
Yeah.
even just a conversation today, this was just like one piece of it. There's infertility, there's surrogacy, there's adoption, there's loss. It's so much. And how all of that impacts your mental health, your brain
Yeah.
functioning, how
Yeah.
your brain changes, just everything. And I think that when people have a little bit more education and humility, that
Mhm.
it will just change so much. And with that, for sure, cultural competency goes a long way, education goes a long way. And I think that for even Black mothers, that will change our own statistics. I'm in Georgia, where our mortality rate is increasing by
Mm.
numbers,
Mm.
specifically after the pandemic,
Mhm.
and how our C-section rates are huge and birth trauma is huge. And I think that if everyone gets on board, those numbers could change.
Mhm. Um, I 1,000% agree with you. And I like, what do you see as the barrier for people getting on board?
I think that,
Providers, yeah.
right, providers, I think that, what I was saying earlier, how a lot may not think that it has anything to do with them and their
Mm.
specific, form of practicing,
Mm.
of thinking like, well, I don't see those people. Um, so it's not something that I should, learn about. I think that it starts there.
Mhm.
Even, while I was on the Georgia chapter PSI board and trying to provide educational trainings to, different OBs on screening and referring their patients, some of them in rural areas not wanting us to do a presentation for them. Rather, it was based off of ego,
Oh.
because it was like, who are you to tell me,
Ah. Oh
when I
gosh.
am, X, Y,
Gotta
and
get
Z.
do away with that. Mhm.
Right. Or if they felt like they didn't want to screen mothers because they often said, like, well, we don't have anywhere to refer them. So I'd rather just not screen them at all.
Right.
Just the lack of care, um,
Mhm.
I think is a huge barrier.
That sometimes so, like, feels depressing. Like, there's so far to go, and, there's only so many mountaintops we can scream from. Uh, you know, it is really hard to break through all of that. This idea that I don't need to, or that's not what's, I think, interesting to your point is that maybe people providers don't think they're like seeing those people, or like that they're not in their practice, but it's only because they don't know what to look for. They are there. they're
Right,
they're everywhere. It's
right.
and whew, yeah, there's a lot of work to do,
Mhm. Right.
for sure.
I remember working with, someone once, and it was through their own birth story that they could get an understanding of what their mother's birth story was and how that impacted their relationship. Like,
Mhm.
it's to me, it's so interconnected that it's not
Mhm.
just, like what you said, if you know the signs or you know what to look for, you can see how it can show up and how that can impact the client that you're working with.
Yeah, yeah, absolutely. Do you get, I don't know. I'm just, I guess, asking you this because I feel it. Do you get frustrated with, like, or how frustrated do you get? How do you keep going? When you're up against people who don't want to learn.
Yeah, I do get frustrated for sure. Where I'll have like these rants in my
Mhm.
home.
Yeah, yeah,
My husband.
yeah.
But I keep going because I remember where I was and I remember what my experience was like, and I wouldn't want that for anyone.
Right.
And whatever I can do, whatever small bit I can do with the work that I do can help me feel encouraged.
Yeah. I mean, I would say it's not a small thing that you're doing. I mean, it's hard, I think, for people, who are in the field doing the work to see the ripple effect.
Right.
But you're doing really important work, and I don't think small at all. I think it's huge, and um, you are helping people heal their own generational trauma, which is like goes out into the future, however many generations. I mean, to your point of how important the first day is, and as you said, there is no way for this to not have an effect beyond, that session in that on that day in that room. It just maybe I'm being way too hopeful, but I just it does bring hope,
Yeah,
that people can at some point be free of this suffering, or at least know how to get through it with the support that they deserve.
right. I agree.
I mean, you're doing so much to further the message to get people, the help that they need and deserve. Can you speak a little bit to what's happening now for you and professionally?
Sure. Now because the pandemic was so impactful on so many birthing parents, I've since expanded into a group practice from when I started into a solo practitioner just to be able to fill that need.
That's a
Um,
big step.
it is a huge step.
It's a
And
lot
a
of
lot of
work.
responsibility. Yeah, it's a lot of work. So running that and continuing to do trainings, I just got back from Savannah, an area, one would think Savannah would have a lot of resources
Hmm.
for PMATs, but
Hmm.
it doesn't. It's
Oh,
like when we talk about our rural areas for Georgia, where there
yeah.
are many who specialize, or a lot of people of color that
Mm.
specialize. But I was down there doing a presentation. So continue to try to offer that educational piece. And I'm really passionate about whatever research I learn or study or am a part of to be able to offer that back to providers.
Mm,
Like we talked about, like PMATS isn't just about postpartum, but there's
mhm.
so much research on antepartum experience or birth trauma, or those who are pregnant after a loss or going through infertility. And so trying to be a part of educating those on
Mhm.
that as well as learning more for myself, is where I am now.
Right. Well, it is a big step to go from a solo practice to a group practice. It's a lot of work, but there you're expanding your capacity and footprint, I guess, and being able to help more people is so important.
Right.
So very important. So um on Push Through Mom, what kinds of things are you putting up there or offering to people through your work?
Absolutely. Community events. So any support groups that I run or someone from my team is running, or any events that we have is on that website. We just did a mindfulness hike this past Saturday at
Oh,
Vickery Creek in Roswell, Georgia, and it was great. We started it out with a meditation. We had sponsorships from different journal companies,
that's cool.
and we're able to just like exist and be. And I love like being able to just take simple things like walking in the woods as a coping mechanism. Like this
Yeah.
is this could do wonders. You don't have to book a flight to Miami to feel refreshed and to get away. You can literally just take a stroll and just
Yeah.
be grounded, and that could do wonders for your mental health. So different events like that, I just absolutely love. And I also do a quarterly Black birth workers meetup where
Mm.
it's different Black birth workers around the state of Georgia can come together and network and exchange resources, and to hopefully build a directory to be able to refer to one another and just learn about who's doing what work. So we'll have
Yeah.
providers from chiropractors to pediatricians, doulas, just anyone who sees any birthing parents being able to just come together and support one another.
Oh, that's so amazing and so important to build community in that way.
Mm.
Um, because then the providers also are feeling the stress of supporting people too, so they need community, or we need community. But just to know that you have a resource and a place to send somebody is so beautiful because not any one of us can attend to every part of somebody's experience.
Yeah,
And yeah, it's beautiful what you're creating. It's amazing.
thank you.
Yeah. Well, I thank you so much for coming on and sharing a bit about your story and all the really important work you're doing.
Thank you so much. I'm so excited that this can be full circle, that I remember like walking up to you and being like, oh my gosh, there's Dr. Cat. I should tell her I love the podcast.
Oh,
And then,
thank you.
months from there, I get to be a guest. So thank you so much.
Absolutely. Thank you, Keisha, again for coming on and sharing this with us. For those of you who want to get connected with Keisha, please go to keishareeves.com or pushthroughmom.com. You can also find her on Instagram at pushthroughmom and at Keisha Reeves. Thank you for being with us on this episode today of the Mom and Mind podcast. Until next time.